Welcome to eAssist Growing Your Dental Business podcast. Tune in as the experts in dental business share tips and tools to grow your practice. To learn more, visit dentalbilling.com. Please welcome our next guest.
Welcome back to another episode of Growing Your Dental Business podcast. Today, we're tackling a challenge that many dental teams face, feeling overwhelmed with administrative tasks that take time away from patient care. These tasks can bog down even the most efficient dental practices, from scheduling, insurance verification, follow-ups, all of the above. So what if there was a solution to reduce stress, improve efficiency, and create a smoother workflow without adding more in-office staff? That is our goal today, and that's exactly what we're discussing. We're going to be talking about virtual assistants in dentistry, and I'm thrilled to introduce my guest, Rebecca Herring. Hi, Rebecca.
Hi.
Welcome. She is a highly respected dental coach, practice management expert, and an advocate for team efficiency. So I love that about Rebecca. She's been in the industry for 25 years. She brings a wealth of experience in leadership development, workflow and optimization, and team empowerment. And her journey began at a very young age as she accompanied her dad, who was a dentist, on humanitarian trips, where she witnessed firsthand the transformative power of dentistry and compassionate care. And I'm going to ask her a little bit more about that in just a second. So today, as the vice president of the Denver DPLN network and an ADOM mastership recipient, and she's also getting her diplomat this year with ADOM. She's also a member of DO, Dental Entrepreneur Women, ADMC, which is the Academy of Dental Management Consultants. She is a driving force in helping dental teams build efficient and motivated workspace. She also hosts her own podcast called the Dental Decoders Podcast, where she shares practical strategies to improve practice management. So I love that. Welcome, Rebecca.
Thank you. It's really an honor to be here with you.
Oh, good. So one of the things I was thinking about, and I'd love to learn more about, is your mission trips that you did with your dad. Tell me a little bit more about that.
Yeah, I appreciate that opportunity. When I was in my early 20s, my dad, who really, much like me, appreciates that opportunity to give back and have compassion for others, would take a humanitarian trip almost every year. And the year he was going, he went to Guadalajara, Mexico. And I got to go along with him and my mom, who's a hygienist, to give back and serve an orphanage in Guadalajara. Wow. Truly transformative. I say it every time. I can't talk about it too much. I start crying. It was truly transformative in those, early 20s, when we think we know everything, to go and be able to witness the power of giving back those smiles, right, to these young kids in an orphanage, and just see them glow and smile. And it really had a huge impact on the importance of compassion care with our patients.
I love that. I think that is just, if there's only one thing your parents taught you, which I'm sure they taught you many, many things, that's the one thing that as humans and as people, that if we can understand that compassionate care and the love for other people and just the willingness to help one another succeed in this life, I love that. That's an incredible legacy to your parents, for sure.
Absolutely. I absolutely loved that. I wish I could have gone like every time.
Yeah.
I still wish I could go today, like on every mission trip, and give back to so many people. So I try to do that today now when I help dental practices and find ways to help them be successful too.
Good for you. I love that. So you focus a lot on the need for virtual assistants. How did you realize there was a huge need for virtual assistants, first of all, in the dental practices? And I'm assuming that you came across common pain points in the practice to realize that there was a need for this. Let's talk about that for a little bit.
So the last dental practice that I worked in full time before I moved on to my own company, I was their chief operating officer, and we had several locations. And probably much like dental practices today, trying to find a really strong team of people that want to come to work, that are there to see your practice be successful, to implement our strategies and our SOPs so that we can make our practices run smoothly and efficiently. It's difficult to bring in a new hire and get them trained and get them up to speed and feel like they're part of our team and like, let's go, right? Let's meet our goals this year. To feel like a couple months or so after they're hired, they come in and they're out the door. They found a better opportunity. Someone's going to pay them 50 cents more an hour, whatever it may be. It's so devastating to a practice who's invested so much into their training and onboarding them and making them part of their team. And we experienced this too. And so as the owner doctors and myself sat down, we said we need to find a better solution, something that's worth the investment, and someone that wants to be here, wants to see us succeed, and feels that investment in their position with our company and wants to stay. Now, we can't make people stay, of course, but we did some digging a little bit, and this was several years ago, and we found this option of working with virtual assistants who are offshore. So being our operations leader, I did some investigating. I did some researching and wanted us to consider this option. Now, I'll be totally honest. I was very skeptical of this option, but we felt like this was an option worth investigating and seeing if this would work for us. So as our team in our 3 locations that we had, as our team at the front desk made their decisions to stay or go on their own, we let them make that decision. We decided to hire 5 virtual assistants who would make up our central hub. I don't use call center because I wanted them to feel like they were part of us. So they made our central hub, and they helped run our 3 locations that we had. It's a lot of work. I'm just going to say that right up front, right? You're training them, but unlike a new hire that's in your practice, they get to sit next to you. They get to listen to you. You can kind of talk about it. You can listen to them and train them, right alongside you. The only difference between someone in your practice and someone who is virtually working for you is they can still technically be by your side, right? They can be on a screen and they can be on Zoom or Google Chat, and you can train them. But they are with you. They're with you all day. And sometimes you've got to step away or whatever, right? But that investment in their training is a little different. They're going to stay with you. So when you're training them and you're working with them and giving them their tasks and responsibilities for your practice, that time and energy and the investment you're making in them is going to be long-term. And so there's a really good feeling in that, especially today, because they are going to be with you forever. And that time and the effort is going to be well worth it. So for us, that was fantastic. We developed and created lanes basically for them to stay in. So they all were cross-trained. They all knew how to do the responsibilities at the front desk. But we found after some trial and error, and of course, me being very systematic, I think, in the way that I like to train them, is I found that if they were all cross-trained, but they had a very specific lane to stay in, that's where we found our greatest success. So when they came in and our first full year with them, they doubled the production in our 3 locations that first full year with our practice. I don't know if I could have even imagined that success
That's
with our virtual team.
Yeah.
What brought on, I think, that first success was, they're not being distracted by other things that are happening in the practice. And so they could take on insurance verification. something that can be very time consuming. Sometimes you have to call the insurance and those types of things. But the other thing that we found is that they had the time and the patience and that soft voice, I think, when they would call patients and say, hey, John, Dr. Smith asked me to reach out to you today. Looks like it's been a year, maybe 18 months, maybe 2 years since he's seen you in the practice. He wants to know how you're doing and how that crown's doing in the upper left that he recommended to you. Are you doing okay? And are you experiencing any pain? He wanted to know if you'd be willing to come in so he could reassess that area for you and get your teeth cleaned so that we can make sure that you're staying up to date and staying current with your oral health and oral care. Is there a good day and time that I can get you in? Because I have an opening right next week on this day and time. Did that work for you? And it was amazing that reach out and that care and that, we just want to wrap our arms around you and get you back in here. How much the patients really loved this. And that the doctor, right? Dr. Smith wants to see you and he cares about you, wants to know how you're doing. I know our practices are busy, right? But when we had a team of people working for the success of our practice, it was amazing. Unbelievable where this influx of patients that we already had on record, these weren't new ones, these are ones we'd already seen, started flooding back into the practice.
Oh, and that's where that production came from, right?
Mm-hmm.
So if you're keeping them all in their lanes, like one person's probably in charge of calling, previous patients that haven't been in for a while. One might be in charge of insurance verification or something like that, just keeping up with that on the schedule, it's day to day. What other lanes did you train for?
So we also had them working specifically with new patients. So the new patient comes in, right? We want to make sure that they got rescheduled for their SRPs or whatever their follow-up needed to be as far as with the hygienist, but also with the doctor. Sometimes we want to just get into a practice and we just clean my teeth and everything okay? Well, you've got a couple issues. Okay, yeah, no, I don't want to do that. And they kind of just fall into the deep unknown.
Yeah.
I think that our patients appreciated the fact that, again, reaching out, how are you doing? How can we get you back in? Hey, Dr. Smith, those types of things.
Yeah.
The next lane we kept them in was the confirmation calls and making sure our schedule stayed full. So we implemented a couple different texts that would go out to patients on certain days that we knew, like Mondays, right? Always the toughest day to come in and see 3 or 4 patients that called over the weekend and decided to cancel. Mm-hmm. Virtual assistants, this is where they can truly benefit a practice because if you're only open Monday through Thursday, right, they can work Friday, Saturday when your office isn't open. And they can still take those phone calls. They can still reach out to patients. And if someone happens to call in and need to cancel, there's an emergency, someone passed away, someone, had a baby, whatever it may be, they're prepared and they're ready with their list of patients that are waiting to get in. They know that there's patients that need to or would like to get in sooner if something opens. And we're not dealing with that concern Monday morning when everybody walks in at 8 a.m. We get to deal with that much sooner and ensure that Monday when we come into the office, we definitely have a confirmed full schedule. And if something happened, was virtual assistants can fill them. That's what helped us with that 80%,
Yeah, that's huge. So I'm looking at all of these lanes and they're all areas that probably need help in, right? So that's why you've probably figured out the lane thing. What do you think was the biggest benefit that you saw with virtual assistants?
For me, I think with our practice at the time, I think it was just a sense of relief, right? Knowing that, if someone at the office had to call out sick, or if they decided to leave the practice, right? we knew that we had our virtual assistants that we could count on. They weren't going anywhere. And so we always had support and backup. They weren't intended to replace anybody, but they were absolutely meant to be a support system for our in-office team. We don't want our teams that are in the practice to have to choose between the patient that's standing there and you're walking through a $10,000 treatment plan with them and the phone that just happens to ring at the same time. We don't want them to have to choose between the two. We want both patients to be equally as important. So the in-office team can focus on the patients that are standing right there in front of them.
Love it.
And the virtual assistants can support you with answering the phones and confirming and answering the questions when the patients call in and say, I think I owe some money on my account. Can you tell me what it is? And can I take care of that for you? Right? Super. Let me take your credit card, or we have one on file in the office already. And want me to use that for you? Yes, that would be great. They just solved an accounting problem for you, a confirmation call for you, while you just sold the $10,000 treatment plan that the doctor just saw that new patient for.
That's nice.
They're meant to support you, really, to support your team.
That's fantastic. I love that. So you said this virtual team is typically offshore. Is that what you said? Typically, where do they come from?
So a lot of different virtual companies will pull from from Latin America, because of course those companies can find you specialty virtual assistants. If you have like a demographic in your area of Spanish speaking patients, or we had to find one for a Russian speaking area. And that's a little harder to find, but we can find those for you for sure, so that they can support your practice and your patient needs. But really, Latin America, the Philippines have become very successful areas. And honestly, the demographic of those countries very much there. They have a lot of people have been to and they've received their DDS degrees, they're dentists, they're hygienists, they've been assistants before, and they are more successful in taking care of their families when they work remotely for a company in the United States. You can find an accountant who can be part of your billing team, and they have wonderful accounting skills. And I mean, how fantastic would that be?
Yeah, that's amazing. Amazing. Well, the thing that I think about too is a lot of those countries, they all learn English. So English is like part of their language already.
It
It's
is.
a matter of implementing that into their everyday, as a virtual assistant.
Right. Yeah. So I want to touch on what you're kind of alluding to in that conversation, which is their accent. And I know a lot of offices that say, I'm really worried about the accent. Can my patients understand them? And a lot of times they do have English as their second but prominent language. They live in a country where people speak both languages fluently. And so English is not uncommon to them. And a lot of times, a lot of them have come to the United States to attend a 4-year university here.
Wow.
And then they go back so they can take care of their families. And you know what? They have TikTok, and they have all the platforms that we have here, and, videos and movies. So they're very familiar with our English language, some of our slang, things that we use in our everyday communication. And so that's not hard for them to pick up. But I do like to also remind practices that are considering this option that, have you ever called someone that has lived in New York their whole life? Or
Right.
someone who's from like Chicago or the Deep South? Who doesn't love an accent? I love someone who has an accent. I love calling someone who's lived in London, right? Or England, or in, Scotland, and has one of those fantastic accents. So we can use it to our benefit and, just remind our patients, right? Or even our virtual assistants. I just tell them Just say, hey, yes, you know what? I was born and raised in the Philippines, and I'm so excited that I get to work with Dr. Smith and his team.
Yeah.
Address it, move on. They're just as wonderful as anybody else who works for your practice.
I love that. People are the same wherever you go. We all have the same, we all want to find joy in our life. We all want to take care of our families. Everyone's the same wherever you go. That's the one thing I've learned. So that's fantastic.
Yeah.
How does a practice know if they are in need of a virtual assistant, even if they might not recognize it? What are the signs that indicate that a dental practice is ready to explore this idea?
So this is a great question. And I think sometimes this is probably one of the more frequently asked questions, right? How do I know? Like, am I ready to support my team? Burnout.
Sure.
Do you feel like at the end of the day, you have either yourself or teammates that are absolutely exhausted? Are you missing more phone calls than you can answer? Do you have long wait times right at your front desk where patients are having to wait to be checked in? Your team is complaining about being overworked. You've got claims that are stacking up. This is a really great way to say, maybe we need more help and we need support.
Yeah. Yeah.
And, we want our teams to feel supported, and we don't want anyone going home or someone who stays, 2 or 3 hours after or comes in super early because they just have so much to do that they can't get caught up. And this is where our virtual team truly can be what I like to call their secret weapon, because they're there to help and support you. And that's really why they're there. They're cost effective. They really are anywhere from, $11 to $15 an hour. And they work so hard and so fast and so efficiently. And that's where they can really come in and say, hey, this is what I need you to do. And then you just kind of keep giving them what they can do efficiently and effectively without being overworked themselves.
That's amazing. I love that. It's kind of a win-win on both sides. Like it's
Yeah.
like a feel-good moment to know that you're helping someone in another country be successful in what they're doing to take care of their family. But yet at the same time, it's helping your own team relieve like that stress, that burnout, efficiencies, all of those workloads that you've got in the dental practice, because there's a lot going on when you talk about all of the ins and outs of a dental practice. So are there any certain things to have in place? Like, are there certain technology they need or processes or systems in order to integrate a virtual assistant?
That's a fantastic question. I'm glad you asked that one. So with a virtual assistant, if you're working with a company that's what they do. They find you the virtual assistants and they're going to help you implement them into your practice.
Wow.
They're going to most likely have a couple of systems already in place for you. One, you'll need to have a VoIP system for your phones.
Okay.
There's lots of them out there and lots of them will work. And because virtual assistants is, becoming a very popular option for so many different businesses, not just dental.
Mm-hmm.
That's how we connect them to your practice, and they can help support phones. They can put patients on hold. Someone in practice can pick those calls up, super smooth and very easy. Getting the VA connected to your practice. They will need a dedicated workstation. It doesn't have to have a monitor. It doesn't have to have, anything fancy, but it does need to have, most practices will put a CPU in, and that's their station. That's where they'll remote in. I think it's beneficial to have a screen attached for the first 3 or 4 months, because if for some reason they have a question, super easy for whoever's in the practice to run over there and just watch what's happening on their screen and walk them through it. Very simple.
Nice.
Some way for them to communicate with the practice. This can be, when we implemented, I just used Google Chat on my screen. That way they can communicate quickly. If they have a question, you can answer right back into Google Chat. And so can anyone else in the office. So if they have a quick question and there's several people helping you within the front admin team, it's all on the screen. Everybody can see. Another really amazing thing to think of is we had, like I mentioned, 5 virtual assistants. And the virtual assistants would jump on and help another virtual assistant, which when you think about it is also fantastic and incredible that they would help jump in, help each other too. It didn't require the office. Those are the basics. The company that you're working with is going to supply your virtual assistant, most likely with their own computer, double monitors if you request that they would need 2, noise canceling headphones, just so that it's super quiet, not only for them on their end, but would cancel out anyone else, would be talking around them, like if they were in some type of a hub. But that's basically really all that they need. It's super simple. And then you as a practice would want to just be able to set the time aside to do some of that dedicated training to the specifics of your practice needs.
Nice. I love it. So let's talk about how the best way to get a hold of you, to figure out what it would take to, I guess to work with you, to figure out if they're in need of a virtual assistant, to figure out how it would look if they did sign up for a virtual assistant. What's the best way to get a hold of you, Rebecca?
Best way to reach me, if you want to, is to send me a quick email, which is Rebecca, REBECCA, at yourtdcoach.com. And I'm more than happy to meet with anyone who just has questions. You want to learn a little bit more, you want to ask very specific questions to your practice needs. I do this complimentary for any office because I know when we did it, I kind of felt like I had a million questions and I just wanted to talk to someone who had done it before.
Yeah.
So feel free, send me a message and I'll get you on my calendar and we can run through and talk about any options that you have. I work with several different VA companies that I really have vetted and I really enjoy working with them. So we can share that information. There's no sales from me personally. I don't benefit. I just love to help practices find what they need to be successful, reduce teen burnout and stress, and help you be more efficient and effective in your workflows in your practice.
That sounds amazing. I think you are definitely the go-to. If anyone is thinking they need a virtual assistant, you would be the one to help them with that. Is there anything else you'd like to cover today that we have not discussed so far?
I think we have hit the listeners with so many things.
I feel like, the what is a virtual assistant, why you would need a virtual assistant, how it works to get a virtual assistant. I feel like we've kind of gone through all of those things. So I think we'll wrap it up for today. Thank you, Rebecca, for being on our show today.
Thank you for the invitation. As you can tell, I'm super passionate about virtual assistants and the benefit they are to practices.
Oh, absolutely. That's wonderful. So this podcast is sponsored by eAssist Dental Solutions. We know how important it is for you to have the right support in the right place to keep your practice running at peak performance. So if you need any help with your revenue cycle management, patient billing, our goal is to reduce administrative burdens, just kind of like Rebecca's company is. So if you could go to dentalbilling.com and just take a look at our services there and how we can help. And also, I would definitely recommend you reach out to Rebecca Herring and see if a virtual assistant is in your portfolio coming up. So that would be amazing. So thank you, Rebecca, and everyone. We'll see you again next time. Thank you. If you have any friends in the dental industry that would be interested in this podcast, please invite them to subscribe, leave a review, share this episode with your colleagues. Until next time, we will see you again.
The purpose of this podcast is to interview the consultants within our eAssist Consultant Network. This podcast is for informational purposes only. For more details, please visit the homepage of this podcast platform at dentalbilling.com. Thanks for listening.